All right, so three things to do in the chart in order to meet some of the requirements for MIPS 2017. Um, so make sure your patient is checked in and go into the chart. So number one is education. Okay, the more education you give, the better. Basically, the numerator is number of people you have educated, and denominator is total number of all patients, not just Medicare. In order to educate, you do one of two things. Um, Number one, you can click on one of these eyes, and it pulls up some educational things. Number two, in your progress note under plan, you go and click electronically identified patient education materials provided. When you save your note, that will get counted in your numerator. So that's education. Number two is medical reconciliation. You need to do this at least once. Basically, in order to do that, two ways in your plan. You can either go up here to medications and click this one and this one. Both medications have been reconciled, and transition of care or provider policy. Or you can go into medications, and under medications, you basically can do the same thing. There's at the bottom, there should be reconciled medications or transitional care. You can do one or the other. Okay. Number three, you need to send a summary of care, which is a health information exchange. This is the Updox thing. So two parts to that. Number one, after you save your note, you're going to click on the star, you're going to click on system links, you're going to click on Updox direct messaging. At this point, you're going to put in the name of the doctor you want to send to. And I think you're going to want to click on find in directory. And all the CAPE docs are here. In addition, there will be hundreds, if not thousands, of other doctors who are in the system as well. So for purposes of testing, I'm just going to choose, I don't know who this is, but we can say sample CCD, and we're going to click send. Sent. This window will close in 3, 2, 1. All right, your thing has been sent. In order to get credit for this, you then need to basically click care and transition, summary of care provided, direct. You do those, then you sign your note, and then you get credit for that. And you need to do that at least once.